Welcome, everyone. Want to say thank you for you all joining from coast to coast. For those who celebrate, happy holiday today. My name is Andy Firmin from Benefit Advisors Group. We are a North Andover, Massachusetts-based Medicare planning advisory firm. We do have agents licensed in all 50 states. I'm going to keep today's conversation on 2026, the 2026 landscape and what we anticipate the changes to be. So the goal of the presentation is to educate you about those changes so that you have an opportunity in a plan and awareness of what to look out for this upcoming annual enrollment, which runs from October 15th through December 7th. For those of you not yet on Medicare, I do think this information is valuable for you as you age into Medicare or as you enroll into Medicare in the future to know what's shaping in the landscape. What I believe we're seeing here in the Medicare landscape is a correction, a market correction, if you will. Plans got, outrageous in terms of what they offered for benefits, and the insurance companies are now starting to correct that. So what I'm going to talk about today is the changes affecting Medicare plans, what we anticipate those changes to be. We can't talk about what those changes are specifically until October 1st. So I cannot answer specific questions about specific insurance companies, specific benefits, or plan information. But this information that we're going to share today will help you, again, identify the areas that you need to review.
Black pad that's on.
We got a question? Can you guys hear me all right?
Yes.
Yes.
Okay, perfect. So we'll talk about a lot of these changes are stemming from the Inflation Reduction Act. So we'll talk about why that matters and what that cost sharing matters to you, the Medicare beneficiary. All types of Medicare plans are affected by these changes. So there continues to be pressure for prescription drug plans. Medicare supplement plans have been affected across the country, as well as Medicare Advantage. Many of you may have already received a document from your prescription drug or Medicare Advantage company called the Annual Notice of Change, the ANOC. We're going to review the important terms and what to look out for in that. And then part of some of the changes that we anticipate for this year may be plans merging together or plan terminations. So we'll talk about that as well. I truly believe Medicare is the intersection of your health coverage and your financial wellness. We want to make sure you have the right coverage for when you have a health-related matter, but we also want to make sure you're not overpaying for coverage that you might not be using at this time. Many of the changes or many of the effects to the Medicare landscape stem from the Inflation Reduction Act of 2022. Why? The Inflation Reduction Act put into place perhaps the most significant changes to Medicare starting this year in 2025 since 2006. Additionally, the insurance companies continue to face higher cost burdens. That's higher claims from care being delayed from the COVID years, as well as the dynamic shift in commercial group employer health insurance. As we see employer health insurance deductibles rise, co-insurance rise, and co-payments rise, we're starting to see folks who are in their 63, 64 years of age as they approach Medicare delay elective procedures because their coverage may be more affordable for them under Medicare. And that's stemming in some claims pressure on the insurance companies. So there's this thing called the medical loss ratio that I'll talk a little bit more about in a moment. And then the Medicare Advantage space, we continue to navigate a changing reimbursement environment. We all hear the TV commercials, no monthly premium, no copay for our PCP. How does that really work? Well, the reason why we say no additional premium or no copay, no premium, is because it's not free. So we can't say free. The way those zero premium Medicare Advantage plans work, the federal government's paying the premium on your behalf. And for those who might be enrolled in a Medicare Advantage plan with no premium, one of the things we'll talk about in this session is we may start seeing a premium introduced on some of those $0 plans. So why does the Inflation Reduction Act matter? The most significant changes in Medicare since 2006 occurred for the plan year 2025 that we're currently in. For those of you currently on Medicare, you may have recalled in the past this concept called the donut hole or the coverage gap. The donut hole has been eliminated. As legislation, part of the Inflation Reduction Act, put into place a maximum out of pocket on prescription drugs for 2025 of $2,000. We already know for 26 that's rising up to $2,100. Not a huge deal. Now, what this donut hole was, prior to this year, we had people on Medicare spending $6,000, $7,000, $8,000 in copays and coinsurance at the pharmacy when they picked up their prescriptions. The legislation several years ago eliminated that and instead placed a $2,000 cap. So the most anyone on Medicare will pay at the pharmacy for covered prescriptions is $2,000. Again, that's rising to $2,100 for next year. But what this change did behind the scenes was it changed who's paying for prescriptions. You can see on this slide I have on the screen, the coral pinkish color is you, the Medicare beneficiary. The dark blue color is the insurance company. The light blue is the drug manufacturer, and the green is the federal government. So we can see prior to this year, prior to entering a deductible stage, you paid 100% of the cost if your plan had a deductible. That doesn't change for 2025, and it's not changing for 2026. What is changing is the other aspects of prescription drug coverage. Prior to this year, after you, the Medicare beneficiary, paid your deductible, you continued to pay about 25% of the cost through copays and coinsurance, and the insurance company picked up the remainder. Now that shifted slightly for this year. The insurance company's responsibility drops about 10%, and the manufacturer is picking up 10%. Not huge changes there. But for those folks who were paying $6,000, $7,000, $8,000 for prescription drugs, and they're now capped at $2,000, there's a significant cost-sharing shift. Prior to this year, you, the Medicare beneficiary, continued to pay about 25% of the cost. The insurance company was only paying 5%, and the drug manufacturer was picking up the other 70%. That has shifted to now the insurance company is picking up about 60% of the cost. So overnight, from 2024 to 2025, the insurance company's average cost on prescription drug costs was about 30%. That is now about 55 to 60%. Now, I don't know about you guys, but these for-profit insurance companies, even the nonprofit insurance companies, they're not likely to absorb that cost on their own. So they're likely to shift that cost onto you, the Medicare beneficiary. So what this is doing is it's shifting costs to you, the Medicare beneficiary, but it's also making the insurance companies look at the profitability of their plans. Now, the insurance companies only have a few levers they can pull to help shift that cost from their books to your wallets. And the first and the most obvious is through higher premiums. So we do anticipate, and we did see this last year, higher premiums on standalone prescription drug cost. For those of you, and I think it was about 80% plus, were on supplemental plans with a standalone prescription drug plan, you may now see higher premiums on some of those prescription plans. What we also anticipate is as insurance companies continue to look at the profitability and the claims experience of their plans, we anticipate them to merge plans or terminate some plans altogether. And then the other lever the insurance companies can play is through their list of covered prescriptions, through what's called their formulary. The formulary is simply just a fancy word for a list of covered prescriptions. And the way the insurance companies can play with the formulary is they can reduce the number of prescriptions that they cover to enhance buying power on the few that they will. They can also introduce prior authorizations as well as step therapy, making it more challenging for you and for your providers. On the Medicare Advantage side, we do anticipate the introduction of premiums, particularly on PPO plans, as well as a reduction of ancillary benefits such as dental, vision, hearing, etc. Let's talk about this a little bit more. On the prescription drug side, what happens if there are fewer plans? If there are fewer plans, if the insurance company is terminating your plan, you now need to go out and find a new plan. If the insurance company is merging your plan with another plan, that plan may not be the most suitable for you or the most affordable. So it's really important for you to review your prescription drug coverage as we enter the October 15th annual enrollment period. Increased plan premiums are anticipated, increased deductibles, where deductibles might not have been introduced in a tier previously. We anticipate that may now be the future. Increased copays, particularly in tier 1 and tier 2, whereas in the past we might not have had a copay for our tier 1 prescriptions, there may now be a small copay introduced. And then this thing called coinsurance, particularly for tier 3 and tier 4 prescriptions. What coinsurance is coinsurance is a percentage that you have to pay. So we're all used to copays, right? If there's a $5 copay, we pay $5, the insurance company pays the rest. Well, coinsurance is, instead of a dollar amount, there is a percentage amount. So for your tier 3 and tier 4 prescriptions, you're going to want to look at those prescription drug copays and see if now there's a coinsurance being introduced for 2026. In terms of stricter plan formularies, Medicare has 6 categories that they require the insurance companies to cover. Now, some insurance companies, let's say, for example, there might be 8 drugs in a particular category. Currently, an insurance company might cover all 8 drugs. But to contain their costs, they may now reduce that from 8 drugs down to 4, 5, or 6 drugs. If one of the drugs that you're taking is one of the drugs that's no longer offered, your only opportunity to know that might be during the annual enrollment period. Because if you get into January and you're not aware that your drug is no longer covered by your current plan, you may not have an opportunity at that point to change. Now, some of us may be familiar with prior authorizations. What a prior authorization is the insurance company might say, if your doctor prescribes you with prescription A, we're willing to pay for that. But we need the doctor to submit some documentation and some paperwork to substantiate why you need that particular prescription. So it may delay your care, the insurance company may deny it, it may be a back and forth with your doctor. In terms of step therapy, the insurance company might say, we're willing to pay for that drug, but we first want you to try this least expensive drug before we pay for it. So the problem with that is, I'm not a doctor, but I have to imagine if your doctor thought a different prescription was better for you, they likely would have prescribed that first. In defense of the insurance companies, step therapy and prior authorizations were initially introduced to protect you because many of us are seeing many different doctors and maybe prescribe something from one doctor that may interact with another. So these tools were originally introduced to protect you, but I do think they are used to contain cost for the insurance companies. And then increased quantity limits. This usually comes with some stronger pain medications, some opioid medications, and they're really there to help control or make sure that we're not being addicted to something that is meant to be a short-term use. We don't want that to turn into something longer term. So it's going to be really important for you to review your annual notice of change to see if there are any plan premium increases, increased deductibles, or deductibles being introduced for prescriptions that you might not have had to pay them in the past, as well as copays and coinsurance. And we did see this for the 2025 plan year. In one example I can provide to you, I had a client who gets their prescriptions filled quarterly. And they filled their prescriptions in December for a 3-month fill that covered January, February, March. They came into April and they had a large $500+ deductible on a prescription that they didn't previously have. And they saw that in April because that was the first time they had used their drug plan. So those types of things can be avoidable. There are plans in this situation that had we looked at that prior to, we could have made a change and maybe saved a couple of dollars there. In terms of Medicare supplemental plans, I mentioned in the opening that the insurance companies are seeing increased claims. What is happening is, and what we're seeing across the board in health insurance, people delayed coverage and care from the 2020, 2021 COVID years. And we're now starting to see over the last 2 years, we're now starting to see some of those elective procedures take place. The other thing that we saw was preventative care was missed. So what might have been caught early on is now being caught when the disease has manifested into something much more expensive, more hospitalizations and more surgical procedures. Additionally, like I mentioned, folks are delaying care from commercial coverage until they get onto Medicare to avoid a high $4,000, $5,000, or $6,000 deductible. There's this thing called the medical loss ratio. And all the medical loss ratio is a ratio relative to how much the insurance company is taking in premiums compared to how much they're paying out in claims. And what we're seeing in the Medicare supplement space, we're starting to see medical loss ratios increase over 100%. Some insurance companies and some plans, we have seen a medical loss ratio as high as 120%. What that means is for every $100 in premium the insurance company is taking in, they're spending $120 in claims. Now, for Medicare supplement plans, the only lever they have to do to make up that difference is to increase your premiums. What's really important when you look at your Medicare supplement plan is not just looking for the lowest cost plan, but it's looking at a plan that has a consistent Medicare loss ratio, particularly over the last 2 to 3 years, as well as historical rate increases. We know and we anticipate that we're going to have rate increases, but we don't want large increases. And in some Medicare supplement insurance companies and some plans, we are seeing quite large 20+% increases year over year. If you're healthy, you might want to take a look at your current Medicare supplement plan. Has that increased? Are there other plans that are more affordable? And the reason why I say if you're healthy, in most states, once you're already on Medicare, you have to go through medical underwriting. They're going to ask you questions about your current and past medical health history. And based off of your current and past history, they may charge you more money or may decline you altogether. But if you're healthy and you're on a Medicare supplement plan and you had a large rate increase, you may want to take a look and see if there are other plans out there. We're seeing the biggest increases in Plan Gs. And across the industry, many experts anticipate that your Plan N is going to have a more stable premium over the next few years. And that's because there are more people enrolled in a Plan G. And as more people come in delaying coverage from their commercial employer plans, they're enrolling in the Plan G because it has a little bit lower cost structure, cost sharing structure. So the Plan N is anticipated to have fewer claims and therefore a much more stable premium over the near term. Of course, that may depend on your market and your area, but that is something to take a look at. Again, as the insurance company's claims rise in a Medicare supplement plan, the only lever they have to pull is to increase your premium. Under Medicare Advantage plans, in addition to the changes in cost sharing for prescription drugs, the federal government has decreased the amount that they're paying these Medicare Advantage plans. And the Medicare Advantage plans are suffering the same dynamic that the supplement plans are in terms of increased medical loss ratios, increased claims. So at a time where costs are increasing for the Medicare Advantage plans, their revenue is also decreasing. So the Medicare Advantage companies are really taking a close look at what their plan's profitability looks like, and they're terminating plans that are not profitable, and they're merging plans together to increase their risk pool. We're also anticipating the introduction of monthly plan premiums, especially in PPO plans. There's a lot of talk across the industry that PPO plans were never really meant to be part of Medicare Advantage. If you understand the whole surmise of Medicare Advantage plans, it was to increase care and increase proactive and preventative care to lower costs later in life, reduce hospitalizations. And if that's the case, the health maintenance organizations, or the HMOs, tend to make a little bit more sense. But the insurance companies kind of introduced more Medicare PPO plans than they anticipated, than they probably should have, and we're anticipating and seeing a correction in that market now. The other levers the Medicare Advantage companies can pull, in addition to increased premiums, they can increase their copays. We may now start seeing small copays introduced for your primary care physicians, increased copays in hospitalization stays, including the increase in the number of days. I don't think we're going to see many deductibles introduced in Medicare Advantage plans on the health insurance side, but we may on the prescription drug side. And then in ancillary.
Sorry, Andy.
Yep.
There was a question in the chat. I want to make sure we get to it. What does NNG cover?
NNG. Can we elaborate on that?
I think that question was from Diane. Diane, if you want to come off mute and elaborate, feel free to. Or put in the chat.
Yeah, I don't have access to the chat right now.
Nice.
Diane, are you still on? Are you able to?
Here I am. Can you hear me?
Yeah, we can.
Okay. I'm a little challenged with Zoom, but anyway. So I thought you had mentioned that I'm new to this and I haven't selected anything and won't until the beginning of 2026. And I understand the Medicare A and B. I thought you had mentioned something about N and G. So
yeah,
I
as
thought
I
that was
pull up the chat, I see that, and now I get the reference. I didn't get it when it was first said to me.
Okay.
So what I mentioned is we believe there's going to be more stability in the Medicare Supplement Plan N than we're going to see in Plan G. And we cover this more in our Medicare 101, but the Plan G covers, these are different types of Medicare supplement plans, okay? The Plan G is going to cover your Part A deductible, currently $1,676 per occurrence, and it's going to cover your Part B 20% coinsurance.
Oh, okay.
The Plan N works a little bit differently. It's still going to cover your hospitalizations, the deductible, but when you go to the doctor, there might be a small $20 copay, or there might be a $50 copay for an emergency room visit. And then the doctor can charge you a little bit more over and above what Medicare pays them. It's not common, it's extremely rare, but they do have that opportunity. So there is a little bit more cost sharing in a Plan N than there is in a Plan G. And historically, more people have just gravitated towards the Plan G because it provided more comprehensive coverage.
Okay, got it. That was it. Thank you so much for explaining that.
You're so welcome, Jen. I'm sorry, I didn't pick up on what you mentioned.
No,
when you
sorry,
asked the question.
you're giving more context.
Yeah, once I read it in the chat, I was like, oh, I know what she means.
Okay.
Yeah.
Go ahead.
Awesome. Any other questions before we move on?
Not from me.
Hey guys, I'm going through this really quickly. I know that. If there are questions, by all means, put them in the chat. And I do like this to be dynamic. So by all means, ask the questions. The other thing I'll say is, as we go through this, some people take the comments and take the information that there's drastic changes coming. There are. But the message isn't that the sky is falling. The message is more, if you're not prepared and if you don't know what to look for, then you may be surprised come January. And at that point, it may be too late to make any changes, okay? So keep that in mind. So under the Medicare Advantage plans, the insurance company has more levers they can pull. And they're also, we anticipate they're going to reduce ancillary benefits. And a lot of people gravitate towards the Advantage plans because they package all of your care into one. The Advantage plans offer plans typically currently with no monthly premium. Again, we anticipate that's going to change. But what you're giving up for that no monthly premium is you're absorbing some cost sharing when you go to the doctor in terms of copays. Medicare Advantage plans look, work, and feel just like the health insurance that you have under your employer group coverage. One of the reasons why people gravitate towards them is there's a lower cost up front, a higher cost on the back end when you use the plan, which can work for people who are healthy. You can oftentimes save money if you're not using the plan. And then people also like how your health insurance, your prescription drug coverage, your dental and vision are all packaged under one plan. And if that's why somebody enrolled in a Medicare Advantage plan, moving forward, there may be some disappointments and some surprises because we anticipate the insurance companies are going to reduce or even eliminate some of those extra ancillary benefits. And then the other thing that we anticipate on Medicare Advantage plans is network consolidation. One of the biggest ways Medicare Advantage plans, just like employer group health plans in the commercial side, one of the biggest ways they control their cost is with negotiated rates with the doctors and hospitals. And as their cost and their cost pressures continue to increase, they may go out to the doctors and they may try to lower cost, or at the very least keep what they reimburse the doctors level. And of course, the doctors are going through the same inflationary periods everyone else are, so they want to get paid more. So we are seeing some pull and push from the doctors and the Medicare Advantage companies in terms of network. And for that reason, we anticipate network consolidation. So if you are on an Advantage plan, you're also going to want to check and make sure your doctors are still in network. Oops. All right, so I've talked about some of these changes to be aware of. On the prescription drug side, we're anticipating some premiums increasing. We're anticipating copays and coinsurance and deductibles to increase. We're anticipating some changes in the plan formulary. On the Medicare Advantage side, many of the same things with the addition of cost sharing on the health insurance going up, as well as the same changes on the prescription drugs and changes in your ancillary benefits. Your prescription drug company or your Medicare Advantage company is required to send you what's called an annual notice of change. Now, this annual notice of change, like everything in the insurance world, is going to be a document probably an inch thick in small fine print. Most people probably don't know what it is or why they're getting it or what they should be doing with it. What you're going to want to pay attention to is the summary page. That's the best place to start. And think about this annual notice of change as being like the check engine light in your car. It's going to alert you to anything that you need to pay attention to or anything you might want to review for next year. So on the summary page, that's going to, in larger print, that'll tell you if there's a premium increase. On your Advantage side, it'll also tell you if there's a change in the maximum out of pocket, the most you'll ever pay in copays. It'll also tell you if there are any network changes at a high level. You're still going to have to go in and check the insurance company's online directory. It'll tell you if there are any cost sharing increases in emergency rooms, urgent care, ambulance, in or outpatient hospitalizations. It'll tell you if there are any changes in your dental or vision, over-the-counter allowance. And then on the prescription drug side, whether it's a standalone prescription drug plan or prescription drug coverage through an Advantage plan, it will tell you at a high level if there are any formulary changes that you need to be on the lookout for. Again, on the formularies, what I recommend you do, Medicare.gov has a very good tool that you can go in, starting somewhere, I'd say October 10th or later. Go on to Medicare.gov and plug your prescriptions in. And what you're going to be looking for is the lowest cost plan that covers all of your prescriptions from both an annualized monthly premium as well as your annualized cost at the pharmacy. And again, Medicare.gov has a very good tool that you can all do that on your own. What happens if your plan's terminated? Now what do we do? There's two types of plan terminations. There's a true plan termination where your plan's completely going away. In that situation, you'll get a notice from the insurance company that basically says, we're no longer offering your plan next year. Here's a list of plans that are available in your area. You need to go and you need to enroll in one of these plans. Now, if you don't do that, if you're on a Medicare Advantage plan, you will be automatically moved back onto original Medicare Parts A and B, and you'll be on the hook for the full Part A hospitalization deductible, as well as the full Part B 20%. Now, if you get into January and you realize that your plan was terminated, no longer offered, and you no longer have prescription drug coverage, or you no longer have a Medicare Advantage plan, you will have what's called the special enrollment period. And that special enrollment period actually begins on December 8th and will go through February 28th. Now, the problem is if you wait until January to find out that your coverage has changed and you no longer have it, you enroll in a plan in January, your plan is going to be effective February 1st, and so forth if you enroll in February for March 1st. So really important to be aware, is your plan terminating? Do you need to go out and take action? The other type of plan termination, this is a soft plan termination, they might merge one plan into another. And when they do that, within the industry, we call that being crosswalked into another plan the company offers. We usually see this in the prescription drug plans. We did see it an awful lot last year for prescription drugs. And again, if you're being crosswalked, or if the insurance company is saying, we're no longer going to offer this plan that you're currently in, but instead we're going to shift you over to one of our other plans, well, that plan may not be in your best interest. So again, October 15th through December 7th is your opportunity to understand that and to review your plans for next year. Under the Medicare supplement side, you can actually enroll in a Medicare supplement plan at any time throughout the year. You don't need to wait until Medicare's open enrollment period. Where this gets tricky is if you're on a Medicare Advantage plan and you want to change to a Medicare supplement plan, you have your prescription drug coverage. And for that reason, the most appropriate time to make this change is through Medicare's annual enrollment period, October 15th through December 7th. You also have a special enrollment period, or open enrollment period rather, January 1st through March 31st. Now, this is important. If you are on a Medicare Advantage plan and that plan is no longer being offered, it's terminated, you need to go find something else. You now have, and you may have, a guaranteed issue right into a Medicare supplement plan. So if you are on a Medicare Advantage plan and your health has deteriorated to the point where you're now thinking, boy, I really wish I had chosen a Medicare supplement plan, this may be a good opportunity for you to get that. So plan termination may work to your benefit, because if you have a guaranteed issued right, the insurance company cannot ask you about your current or past medical health history, and they can't deny you access to the plan. So keep that in mind as well. Guys, in closing, again, this is meant to give you an idea of what is taking place in the 2026 Medicare plan landscape. What do you, as the Medicare beneficiary, need to be on the lookout as your plans may change for next year? So it's important to stay informed. It's the only way that you can make a good decision about your healthcare needs and your budget. Again, Medicare is the intersection of your health coverage and your financial wellness. So it's really important, as your annual notice of change comes in, review that summary page, understand what your coverage for next year looks like and how it may be different from this year, and go on, use tools like Medicare.gov, reach out to a licensed independent broker, ask someone for help who can review all the plans available in your area. That's all I have for you for today. I'm happy to take any questions. If you're not yet on Medicare, if you have questions about what different coverage looks like, if we have time, Jen, I'm happy to answer those questions and walk folks through that side of things as well.